Tonight, there is new hope for stroke survivors.
An implanted device once only used to help people living with epilepsy is now, for the first time in Iowa, helping stroke survivors regain mobility in their arms and hands.
Let's try that orange one next to it, Gary.
This isn't Gary Luna's first time in rehab. He isn't the average patient.
Good squeeze of the cone.
At 80 years old, he's an experiment, attempting to master something he hasn't been able to do in years.
Oh yeah, muscle memory is in there deep, but he golfed for so many years.
Physical therapists at Yonker Rehabilitation in Des Moines are helping Gary golf.
See if you can squeeze a little bit more with the right hand.
2 years ago, doctors told the retired fighter pilot he would never gain full function back in his right arm and hand after having 2 strokes, even after therapy.
So he's like, your dad's had a stroke, brain doesn't regenerate, so this is your life now. You know, you have to just learn to live with these deficits.
You can imagine what that kind of news can do to a person.
It's been so hard the last 2 years. I want it to be easier for him again.
That's until doctors suggested to Gary's daughter, Catherine, an idea she had never heard of.
What if we did vagal nerve therapy with stroke recovery? Thank you for thinking of that.
Catherine and Gary were all in.
He was like, when can we do it? Let's do it tomorrow. I mean, the minute he heard about it, he's like, can we do it tomorrow? I was like, pump the brakes.
Dr. Simon Wright is Gary's surgeon. The Des Moines doctor has performed hundreds of vagus nerve stimulant implant surgeries, but never on a stroke patient until now. The FDA recently approved the device, which sends electrical pulses along the vagus nerve. That nerve acts like an information highway to the brain. When paired with rehab, it can build new connections in the brain to improve arm mobility even years after a stroke. A game changer for stroke survivors.
For this kind of thing to happen, which seems almost miraculous.
You call this little device that's the size of a key fob or so miraculous.
Yeah, I think that my guess is that Gary will think this is miraculous, and many other people like him. It's pretty impressive to see even the change that he's had already. It's striking.
Come back to that one and push it in.
Gary is in the midst of what his therapists are calling rehab boot camp. It's the critical 6-week window post-implant to rewire connections in Gary's brain.
We're going to do this 20 times. We're on 3.
Picking up and gripping a pen takes practice. As Gary repeats the steps, his therapist clicks a small remote.
Lift. Place.
Each click sends an electrical signal to Gary's brain, strengthening his ability to use his hand and arm.
Slowly pull. Slow, slow, slow.
Gary hasn't been able to write in 2 years.
Okay. Can we try something? Okay. Will you write your name?
That's a question met with cautious optimism.
Let's give it a go. No pressure. There's only cameras on you.
As the retired dentist writes his 4-letter name, it takes him nearly a minute. In this case, practice doesn't make perfect, it makes progress.
Gary, you can read it. Nice job. Nice job.
After just 1 week of therapy, Gary's handwriting went from basically unreadable to this. Remarkable progress thanks to vagus nerve stimulation.
I keep telling him, I go, you're a trailblazer, and he just laughs. And I'm like, but no, really, Dad, like this could bring a lot of help to people.
Dr. Wright believes VNS could spark a medical breakthrough.
And until a study proves it, we don't know. But if it can help with an upper arm, maybe it can help with a lower leg. And if it can help with a lower leg, maybe it can help with a voice box.
An experiment already delivering its most important outcome, hope.
The hope that I feel that I have not felt in this journey is amazing, and I'm just so thankful.
In Des Moines, Jody Long, KCCI 8 News, Iowa's news leader.
And Dr. Wright expects this procedure to take off in popularity in the next 3 to 6 months. He tells me there is already a waiting line for it. Stroke survivors 6 months post-stroke are eligible for this device, and doctors say the implant can improve function by 2 to 3 times. It's absolutely incredible. Gary is working so hard. He's about halfway through his boot camp rehab right now, so I hope to check in with him soon.
Gary, we're cheering for you, getting emotional watching his progress. And Dr. Wright, what incredible, incredible work. Great story.
Yeah, thank you. Thank you. All right.